I thank you, John, and good afternoon and good morning, every seminar. And I present only few case, a special case of pediatric aneurysm embolization. Is 10 patients have 12 aneurysms. This is the localization and age. Male of 50 months, callioso marginal, ACA, MCA, gyrus marginali, petrocavernous vertebral, left pica, basilar tip, and bifurcation. This is a blister aneurysm. Okay, the first case is a boy, 8 months, have a frontal and subdural hematoma, and the neurosurgeon removed the hematoma and partial lobectomy. And in the first angio in emergency, the angio is negative. But 3 months later, I have a control angio, and in AP view, you are lobectomy, hypovascularization of this part, anastomosis, leptomeningeal anastomosis, and 2 dissecting aneurysms around the forks. This is a pericallosal artery, and this is the forks. Probably it's post-traumatic. This is in lateral view. And the problem to treat this is, if you navigate here, the A2 in the left side, anterior segment A2, is too small because I have a lobectomy. This is the right pericallosal, but this is the left hypoplastic, and this. To treat this, I decide to navigate with the small microcatheter, magic, to this point, and then glue it. And the glue, dilated glue is totally occluded the aneurysm. This patient was treated about 2022, 21, 2001 or 2002. Sorry, I used the onyx, not the glue, onyx. Finally, the patient don't have deficit, major deficit, and total cure both aneurysms. This is post-embolization. You are here, the left anterior carotid, anterior segment, E2. You are collateral circulation of leptomeningeal, posterior pericallosal anastomosis. Here is the onyx, and this is the control in the carotid artery. Second case is 7-year-old, neurofibromatosis and seizure. I have a bilateral giant aneurysm, dysplastic, in the right, in the left. This patient is treated also in 2000, 2001. And also have a dysplastic aneurysm in posterior communicant artery. I decided to put some coil to prevent this part of the aneurysm and don't touch this part. In this period, don't have the flow diverter devices. Another patient, 12-year-old, hematoma and seizure, aneurysm in the left hemisphere, gyrus marginalis, selective. I'm coiling. This patient is about in 1984, 1985. After coiling, but I decide to surgery 3 months later because growth the aneurysm is the first or the initial case of GDC coils in my experience, in 92, 93. Other complex case, treated in acute phase, 2-year-old boy with intraventricular hemorrhagic, ventricular drainage, grade 4, in arrival to hospital, and 2 weeks later, after bleeding, going with my center. And this patient have a pericallosal aneurysm. This is oblique projection. This is A1, A2, and this is a fusiform aneurysm, AP view. And I decide to put coils and test occlusion with coiling. In this moment, I see the contrast, stagnation, the contrast inside the aneurysm. And in the late phase, I have a good collateral leptomeningeal anastomosis. It's general anesthesia, it's impossible to test the child, it's 2-year-old. I decide to liberate the coil because I have a good collateral anastomosis. This is before, this is after, and late phase, you are the collateral anastomosis. This is few months later, you have the total collateral anastomosis and reconstruction of the vessel, a total occluded without symptom. This is 3 months later, angio stabilization. The patient at the moment is very fantastic. It's not done deficit, very good, very good. Other more complex case is a female, 40 years old, fusiform giant petrous and internal carotid right aneurysm. Left. AP view, lateral view. But this patient have occluded, spontaneous occlusion of the siphon in the right side. Only the right carotid down the ophthalmic artery. The neurosurgeon performed 2 bypass, one in the right, another in the left. And then still the patient, because the surgeon talked with me, neurosurgeon, Luis, it's possible you put a balloon distal part, and you put the balloon and the patient is well, I don't operate the aneurysm, okay. I navigate, it's very odd case also. I put the balloon. Look this, before treatment, the anterior communicant artery is still open, and you have the middle cerebral artery in the right side. This is the right carotid, the internal carotid artery, only ophthalmic, and collateral anastomosis with inferolateral trunk and some branch of the middle, but very poor anastomosis. Test balloon occluded. The patient are well, but 24 hours develop hemiparesis and aphasia. This is the balloon. This is an MR 1 week later. Total occluded the balloon, the aneurysm. The patient recovery slowly recovery to this hemiparesia. And the evolution is well, but 5 years later, I have a control. You are the collateral anastomosis with posterior communicant artery still open and now open. And this is the evolution. This patient have one dysplasia, vascular dysplasia, elastorhexis. I think it's Ehlers-Danlos. And 20 years later, after this control, the patient going with my consultation and bleeding and death. Another case, mild 30-year-old, also neuroferomatosis, middle cerebral fusiform aneurysm, is treated in 91. Before a period of coiling, I only treated the patient with a balloon. This is a MR. You have edema or gliosis around. I treated with a balloon. You have stagnation of the contrast. The patient that has an external anastomosis, still well, and the balloon only placed in this part, and this is the control. You have partial thrombosis of aneurysm, but still the patient well. Other patient, 3 months, mild pseudoaneurysm of the vertebral, right vertebral. This is MR, axial view. Probably is secondary, this is dissecting aneurysm by punction. I treated in this period with a balloon, put the balloon here, detachable balloon. You see the balloon before, after, and thrombus in the aneurysm, totally occluded. Other complex case, Glasgow 5, subarachnoid hemorrhagic, in emergency treated with coiling, and 2 weeks later, I treated with a stent. This is coiling, and this is a balloon expandable stent in this period, cardiac stent. The stent is here, and the stent is here. You have the cell, the stent, the coil, unpacking a totally occluded aneurysm. Other complex, 3 months, male, 3 months, come with a Hampton-Hughes 5 hemiplegia, and only with my microcatheter spasm, I put coiling in the aneurysm and coiling in the neck, totally occluded, in emergency. This is the last case. It's a difficult case. It's a blister aneurysm, treated in 2005. This is the blister aneurysm, large neck, and a small fundus. Oblique projection, catheterization, and coiling, and protect the aneurysm of the patient well. This is the result of this series of 10 cases of neurofibromatosis, partial occlusion, both occluded aneurysm with different techniques: coil, balloon, coil stent, onyx. Complication. In the petrocavernous, 1 year hemiparesias, 1 year later improved, but 20 years later, the patient rebleeding and dead. And the MCA aneurysm of Recklinghausen have a hemiparesia but finally recovered. Okay, thank you for your attention.
Okay, Louis, thank you very much. Ike, are you here?
Yeah, I'm around, John. I'm around, but maybe Subin can moderate. And is Yuha not here?
No, Yuha's not here. No, he's not here today.
Yeah, my regards to Luis and Subin, and maybe Subin can moderate.
Okay, Subin, go ahead, Subin. Are you there, Subin? First of all.
Yeah.
Oh, no, he's busy. He's busy with technical things. We'll just open it up here to the panel if any questions or comments for Louis. Here, Louis, I'm going to bump you off the screen there.
Hello, Luis Lopez.
Yes.
Hey, Victor.
How
Good
are
to
you?
see you, Victor.
Hello, Ipe. Nice to see you here. I have a question, Luis Lopez. Your patients were treated in which period of time? I mean, when was the first child with this kind of aneurysm, and the period of time to treating them? So how many aneurysms in child have you seen and have you treated in your experience?
Yes. In this revision, in this example, I treated in acute phase every case of the bleeding aneurysm and small, not the giant aneurysm. And I have more than 30 patients of child aneurysm. No more. It's not common. It's very rare pathology. But when you are the patient with a complex aneurysm in the child, is difficult to choose the method or the device. Now it's most easy because you are for diverter or you are more material to coils, different coils and balloon remodeling. In this period, I don't have this material.
And how many of them with genetic disease? You told us that one of them had Ehlers-Danlos disease and other two more neurofibromatosis.
Yes. Yes.
Only three?
Oh, yeah, I remember only three. Yes.
Okay.
Also have aneurysm, but mycotic aneurysm is with this is most common.
Okay. Thank you, Luis. Congrats.
Thank you. Thank you.
You are mute, John Bennett. You are mute.
I'm sorry. Thank you very much, Louis. If there are any more closing comments or questions from anybody in the panel? I know Ben probably had some, but he's too busy. He's that way. He's working hard.
Yeah,
Okay.
actually, I'm translating, but you know, today the screen is delayed a lot in my side, so I couldn't see the cases very clearly. Only I could only see Louis' presentation. Maybe presented 4 slides.
Oh,
I don't know
okay.
why.
Well,
Yeah.
that's the
So,
Chinese website that's having issues.
Yeah.
It happens all over the world. Okay, great. Okay, thank you, everybody. We're going to close this next week. I think you will be back, hopefully. And thank you very much, Ben, for all your work and for translating and doing promotion. Thank you very much. And thank you, Louis, Victor, Ipe, and everyone else for coming. And we'll see you guys next week.
See
Thank
you.
you.
See you
Okay,
next
see
week.
you
Thank
next
you
week.
so much.